Hi, my name is Angela Wilson-Panisi. I'm a physical therapist at Lakeshore Sports Physical Therapy in Chicago. And today I'd like to talk with you about how physical activity can help you take charge of your blood sugar. Participating in a physically active lifestyle can decrease your blood sugar, your blood pressure, your bad cholesterol. It decreases your risk for heart disease and stroke, your risk of falling, decreases your body weight, body fat, and stress levels. And it can help you increase your good cholesterol and your energy levels. It improves your body's ability to use insulin. It keeps your heart and bones strong and your joints flexible. And perhaps most powerfully is that it can prevent or delay the development of type 2 diabetes when combined with a 10 to 15 pound weight loss that's accomplished through diet and exercise. What we also know is that even short periods of inactivity can have a devastating effect on your body's ability to control blood sugar. So if you have short periods of inactivity, like maybe you had to be on bed rest because you had the flu for a couple of days, or you decreased your walking distance because it's been snowing and icy outside, you'll start to see a decrease in insulin sensitivity. On the other side of the spectrum, endurance athletes, who clearly exercise all the time, if they had only 2 days of inactivity, their sensitivity to insulin went down significantly. So in the same way that being inactive can have immediate effects on your blood sugar, starting a healthy lifestyle, a physically active lifestyle, also gives you an immediate benefit. If you can exercise for 1 hour for 1 week, that's all you have to do, 1 week to get it started, you will see a 20% drop in that first week in the maximum daily blood glucose, as well as just an overall decrease in the variability of blood sugar throughout the day. That's powerful information. So what types of physical activity count? What will give us the benefits in terms of managing blood sugar? Well, one option is to just simply be extra active every day. You can walk throughout your day, try to take extra walks, breaks through your day. You can spend time working in the garden, playing with your children or your grandchildren, try to take the stairs instead of the elevator, washing the car. All of these activities add physical benefit to you. It's also very beneficial if you can participate in aerobic exercise, which means that your heart rate pumps a little bit faster. And if you can do 30 minutes of brisk activity 5 or more days per week, you will definitely see the benefits of physical activity. And this aerobic exercise does not have to be done all in one shot. You can break it up. So some people suggest a 10-minute walk in the morning on your way to work, a 10-minute walk at lunch, and a 10-minute walk before dinner, and you've got your 30 minutes of aerobic exercise. Participating in strength training has benefits as well as stretching. So going back to aerobic exercise, that type of exercise that gets your heart pumping, there are certain precautions that you should consider if you have type 1 diabetes or type 2 diabetes. So if you have type 1 diabetes, you should really avoid strenuous, vigorous exercise if you have ketones in your urine. What ketones mean is that your blood sugar is high and your insulin levels are low. When you start to exercise more, your muscles will start to release more blood sugar in an effort to give you energy to burn, and that will actually increase your blood sugar and can have negative effects for you. If you have type 2 diabetes, you should really follow your healthcare provider's advice regarding exercising when your blood sugar is high. If you're performing light or moderate exercise, it will usually decrease your blood sugar. Other considerations when you're choosing a mode of exercise is that if you have numbness in your feet, think about activities or footwear that minimize pressure. Just make sure that you don't have too much friction going through your feet with your exercise. And then monitor your skin integrity after you exercise. So take a look, visualize your feet, make sure there's not areas of excessive redness after you finish exercising. Now, if you exercise strenuously, you can really cause your blood sugar to drop. And symptoms of hypoglycemia, low blood sugar, are shakiness, weakness, irritability, hunger, fatigue, and confusion. And this sort of rebound effect can occur even up to a day later after strenuous physical activity. So you want to be monitoring things if you're exercising more strenuously. So good questions for you to ask your healthcare provider. Should I change my medication when I exercise? Should I check my blood sugar before I exercise? Or should I consider having a snack before I exercise? While you're exercising, you might be out for a walk in the community. You want to make sure that or at the gym, that you wear your medical ID bracelet or necklace, and that you carry ID in your pocket in case something happens. You also want to carry glucose tablets or food with you. And then check your blood sugar during exercise if you're planning to exercise more than 60 minutes. And finally, check your blood sugar after you exercise. So if you have low blood sugar and your blood sugar is below 70, proceed with one of the following right away, which would be 3 or 4 glucose tablets, a serving of glucose gel, which would be equal to 15 grams of carbohydrate, a half cup of fruit juice, a half cup of regular soda, not a diet soda, which wouldn't have any sugar in it, 1 cup of milk, 5 or 6 pieces of hard candy, or a tablespoon of sugar or honey. Then, after 15 minutes, check your blood sugar again. If it's still too low, have another serving. And keep repeating that every 15 minutes until your blood sugar is 70 or higher. If it's going to be an hour or more before your next meal, go ahead and also have a snack. Effects of strength training on blood sugar. So, resistance training is actually associated with improved insulin sensitivity, sugar tolerance, and glycemic control. And if you exercise with strength training, so some type of resistance, more than 30 minutes a week, which is not that much, you're going to decrease your cardiovascular risk disease by 30%. It will decrease your risk of metabolic syndrome and decrease your risk of death. And this will happen even if you don't notice a significant change in your body weight or composition. So the simple act of having more muscle tissue provides your body with significant benefits. So we all know the benefits of physical activity now, but how can we be successful with a consistent, ongoing physical activity program or exercise program? Well, one suggestion is exercise with a friend. A friend will help get you motivated when you don't feel like going. It will hold you accountable if you've been going too many days in a row without exercise. And so regular exercise with a friend can be a very important component of long-term success. Log your exercise and your blood sugar so you can keep track of your progress, and then reward yourself for doing a good job. Not necessarily with a sweet treat per se, but give yourself some other type of reward that will keep motivating you to exercise. And then address your barriers to physical activity, and this is in particular where a physical therapist can help. If the reason that you don't walk is because of knee pain or foot pain or back pain, you need to maybe think about having a consultation with a physical therapist or ask your doctor about consulting with a physical therapist to figure out how you can maximize your physical function that will allow you to reap all these wonderful benefits of being physically active. For more information, refer to What I Need to Know About Physical Activity and Diabetes, a publication of the National Institutes for Health. Thank you for listening. Again, my name is Angela Wilson-Panisi with Lakeshore Sports Physical Therapy, and we wish you great luck and great success in beginning your physically active lifestyle.